Hello, my name is Priscilla and I am a registered nurse. I am here to show you how to give your IV medication in the IV push method. IV push is only available for certain medications. This includes ceftriaxone, which is Rocephin, cefazolin, which is Ancef, cefepime, daptomycin, and there are many others, but please listen to your doctors and follow the infusion company's protocols. We are going to go over the supplies and how to give the medications. At the end, we will go over how to care for your PICC line and what to look for when you are home. First of all, let's go over the supplies. So we will be giving you alcohol swab, which is for cleaning. You have the IV antibiotic, which comes in the syringe, and then you have your flushes. The flushes include normal saline flushes and also a heparin flush. If your physician prescribed it, you will be giving your heparin dose at the end of the day, but it does depend on the doctor, so please follow your doctor's order. So the first thing that we need to do is put the medications in the refrigerator. When you receive your box of supplies, the medication will be on ice. So you want to take the medication out of the ice box and put them in the refrigerator. The flushes you can leave out on room temperature. The reason why we put the antibiotic in the refrigerator is because we give you a week's supply at a time, which means we need to keep them in the fridge for stability. So when it comes time for you to give the medication, we want you to take it out of the refrigerator so it sits at room temperature. IV push can be given once a day, twice a day, or even 3 times a day. So please follow your doctor's order and call your nurse if you have any questions. For IV care, you will also discuss with your nurse if you have any issues. We will discuss that at the very end. So I'm going to show you how to give your medication. I do have in front of you my instruction sheet. This will go over every step that you need to follow from start to finish. And if you have any questions, you have your nurse as a reference. So because you want to make sure you follow your medication schedule on time, I recommend using an alarm clock, setting a timer on your phone to make sure that you take it out of the refrigerator on time. Now we're going to go through the instructions. So we're going to follow my sheet from top to bottom. The first step is to take the medication out of the refrigerator about an hour before. If you forget, don't microwave it. You want to leave it out so it thaws out on its own. You can also use your hand, try to warm it up if you can, or put a warm towel around it. But like I said, do not microwave it. Number 1 is to wash your hands. You want to use soap and water and wash your hands for 30 seconds. That is 2 happy birthday songs. You want to scrub vigorously and make sure you dry your hands with a paper towel and turn off the faucet with the paper towels. You may apply gloves right after. The second step on the sheet says to open up the IV clamp. You may or may not have an IV clamp on your PICC line or your midline. If you don't see one, don't worry about it. If you do see one, you definitely want to open them. Think of the clamps as like a door. You open it to let the medication in and you close it when you're done. On my extension tubing, I'm going to open my clamp. So this clamp here, if you look at my other video on the screen here, all you do is you slide it open to open the clamp. As you can see, there is a green cap at the end of my extension. The green cap is called a Keros cap. This is an alcohol cover which keeps the end of your IV clean and away from bacteria when you're not using it. Everything that you see here is a single use only. Once you use it once, throw it away. We are not going to reuse any supplies. We will be giving you enough supplies to last you for a week. So once we open up the clamp, we take out the cover and we're going to clean the port with alcohol swab for 15 seconds. Take the swab and we call it scrub the hub, and you want to clean for 15 seconds. That's 1 happy birthday song. Be careful when you're cleaning because you definitely don't want to dislodge or disconnect your port from your tubing. So just be careful when you're cleaning that you don't do that, and hold the base of your port. Okay, so we're gonna clean. This is 15 seconds. The next step is to flush your IV with saline. Saline flush is used before the antibiotic and after, which is why we have 2 of them out. Every flush will have a little air bubble at the top there. I'm going to put it up so you can see the air bubble right there. So what you want to do is you want to remove the air bubble before you connect it. And as you can see, I did not put my IV down. I just cleaned it, so I don't want to put it down. I'm going to take the cap off. And I like to squeeze the air bubble out of the top there. And if it leaks out, that's okay. That means there's no air bubble. To connect your IV, we are going to push and twist. There's a spring on the port, so you want to push and twist to lock it in. The proper way to flush is to use the push-pause method. Push, pause, push, pause, push, pause. The flushes can go in pretty fast. When you're done, we're going to disconnect. Number 5, we're going to clean again with alcohol swab. So you're going to clean in between. So you want to scrub the hub for 15 seconds. Next, we're going to hook up the antibiotic. The antibiotic will have no air bubble, so keep that in mind. You will be able to see it as well. You want to inspect your antibiotic to make sure there's no particles. Make sure you check your name, the medication, the dose. Make sure you look at the expiration date. If that looks good, we're going to connect the antibiotic. So it goes in the same way. You push and twist. Now, this is the tricky one. You want to give this over 5 to 10 minutes. So you're slowly going to push it in over 10 minutes. Most people set a timer, or you can always calculate it by pushing a couple lines in and waiting a minute. Push a couple lines in, wait a minute. The overall goal is to give this between 5 to 10 minutes. It's too harsh on the veins to give this all at once, so you definitely want to give it slow. Okay, after 10 minutes, the next step, clean again. Clean for 15 seconds. You want to scrub the hub, 1 happy birthday song. Next, flush out again with another saline flush. Remember, you flush before and after to ensure that there's no IV clogging. There is another way you can flush your saline. If you forget to take the air bubble out, what you can do is turn the syringe upside down so that the air bubble is on top. And then you would push, pause, push, pause, push, pause, and go all the way down until you see the air bubble, but don't flush it in. So you stop before it hits the bottom. There's 2 ways you can flush. Most people take out the air bubble first so they don't forget. When you're done, disconnect. We're going to clean again with IV alcohol swab. And then we're going to do the last flush of the day, which is the heparin. So heparin's a blood thinner. It prevents your IV from developing clots. The reason why it's last is because it's going to coat the line when you're not using it. So take out the air bubble there. Connect by push, twist. Same push, pause method. Okay, when you're done, get a new swab, clean again. You'll go through about 5 alcohol swabs or so. After you're finished, you want to apply a brand new green cap. And then close your clamp if you have one. If you have more than 1 IV line, you definitely want to flush the other line. When you flush the other line, you want to grab another saline and another heparin, and you do the exact same steps. You want to clean the IV, flush the heparin, clean the IV, flush the saline, and then flush the heparin. And then you want to apply a brand new green cap. You want to provide daily maintenance if you have more than 1 IVs. That way you have the other lines as a backup line if one stops working. If you do develop a clot in your IV line, you will know right away, because when you try to flush, you'll meet resistance. If that happens, you want to call your nurse right away and they will help you fix the problem. Regarding your PICC line and your midline, you want to keep the dressing clean and dry. So when it comes time to taking a shower, you might want to get some help with covering your IV dressing with saran wrap and a trash bag. If you notice any redness, swelling, any pain, you definitely want to call your nurse right away to do an evaluation and assessment. If you have any questions, your infusion company will give you a 24-hour pharmacy number, and you always have your nurse or home care agency as a backup. Thank you, and I hope you learned how to give your IV push.